Hello and welcome back to our tutorial at Nebula Insurance Learning Center. Today we're going to talk about Medigap insurance, or what we call Medicare supplement. Once again, you have my information. If you need to get in touch with me or you want to talk about health plans and insurance plans, please feel free to call me or send me an email. Okay, so this is a brief history about Medicare supplement. As usual, I always give you a little glimpse of when it was first started and where we at now. I also give you a link of the history of Medicare supplement plans. It's a very great article. I put the link back at the website, Nebula Insurance Learning Center website, so please feel free to go over there and get the link and read about the history of Medicare supplement. Okay, so what is Medicare supplement? Medical supplements are designed to fill in the cost gaps of the original Medicare program. That's why they're called Medigap insurance. From 1980 to now, the Medigap plans have changed to what we have now. Now, one thing that you need to know is that they are regulated by the federal and state laws. These are standardized programs. It means that every company must conform to the state guidelines, they must be approved by the state, and they must be standardized. Which means that no matter who the company is, from the largest company to the lowest, they all have to offer the same benefits. And basically what it comes down to is the customer experience with that company. So what are those benefits? Okay, so what I decided to do is go from plan A to plan N, compare each plan against the original care, compare the cost of that plan, and see if there were cost savings or not. I have set a scenario with Margaret's story, which we saw back on the original Medicare slides. So basically, Margaret paid a total of $4,186 during her stay in the hospital. She also went to the skilled nursing facility for 21 days and she incurred $161 for that. During her hospital stay, Margaret incurred a total of Part B cost of $1,500, which Medicare only approved $1,000, so she had to pay extra charge of $115. Now she basically has to also pay her Part B deductible of $166. Okay, so the first 3 pints of blood she also has to pay because they was used, and since it was not donated, she had to go and pay the first 3 pints of blood, which original Medicare does not approve. And she had to pay 5% of approved amount on a hospice care co-insurance. Now Margaret was not in a hospice, but that's what normally is the copay for approved amount of services. Okay, so we have that scenario. Now this here is Plan A. Plan A of the Medicare supplement covers Medicare Part A co-insurance hospital cost up to an additional 365 days after Medicare benefits are exhausted. Now in this case, if she used original Medicare, she would have to pay out of pocket $1,610, which are days 61 to 65. So now with Part A, she saved $1,610. Now I put $16,600, I'm sorry, but you know what I mean. She also saved on Part B co-payment of $1,000, which was the approved amount that Medicare paid for. She also saved $450 for the 3 pints of blood. If she went to hospice, she would have saved 5%, but for the purposes of this scenario, we're not going to include that in our math. So she saved $3,050. So some of you may not have a calculator on hand, so you just have to listen to what I say, or you can get a calculator. She saved $3,050. Now she still has to pay the 161 days because Part A does not cover the next 6 services, only the first 4. She still has to pay the deductible of $2,576 because she had to use 2 deductibles. According to the scenarios, she paid 2 deductibles. She still has to pay the Part B excess charges, and I put $2,000 there just for foreign travel. No, she may not have used foreign travel throughout that year or not, and that's fine. I just put it there so you understand that that could be savings if she does travel and get sick out of state. Now, but let's look at what she saved. $3,050 that she would have paid on original Medicare. The premium, the normal premium for Part A in Florida, so I'm going to use Florida premiums. Now, other states are much lower. Some states are hundreds. Again, it's state driven. But here in Florida, for Plan A, you're going to pay a total of $1,596. So if you look at it that way, she basically saved $1,454 for having Plan A. Now, if for the whole year she did not use the hospital and she did not have any Part B services, then basically you paid $1,596, but you didn't get anything for that. But again, remember what we talked about. Everything is about risk tolerance, right? Do you really know in the next 5 years, year 1, 2, 3, 4, 5, if you're going to end up in a hospital if you're 65 years and older? We don't know that. And that is why you have Medicare supplement, to cover the cost in case it happens. B is the first. Okay, so you can see Plan C covers the deductible, and Plan is 2208 minus the deductible minus the excess charges. So in this case, with Plan D, she's saving $144 in premium, but she has to pay the excess charges and she has to pay the deductible. So with Plan D, is 2208. So you are saving yourself $246 a year. And if we divide that into 12, that's enough to pay for your plan. It's $756, but it has a deductible of $2,180. So you have to spend $2,180 before the company starts paying. But you are paying the premium of $76, which is $63 a month. So it is a high deductible. So in case of Margaret, if she would have done this, and she would have to pay $2,180 out of pocket, and then premiums of $63. So basically, you add that plus the premium. So you're paying $2,136. Um, Again, it's a matter of risk tolerance. What are your needs? And that's all it is. Now, this is a chart that compares A, B, C, D, F, G, K, L, M, N, all the plans all together. So it is confusing, but the more that you look at it, the more that you hear the explanations, the more that you take a calculator and make the math, the more that you have a good feeling about what your health is, you feel now, and how you may feel later on. All that has to come into consideration before um, picking a plan. No, I'm going to tell you a little secret here that most insurance agents won't tell you. Let's say that tomorrow I will go ahead and get you into one of these plans. Let's say I get you in plan F, which is the best plan. And later on, you're thinking, you know what? Brian also told me about plan N. So maybe I made a rash decision, even though I did the research and Brian explained it very good to me. Well, the great thing here is that you can switch plans anytime, especially within the same company. Okay? So that is a great thing about Medigap insurance. There is no such thing as an open enrollment period for Medigap. Now, there is another secret out there that people do not know. Okay, so the great thing about Medigap is that you can get it anytime during the year, unless you have Medicare Advantage. You cannot have Medigap insurance while you have Medicare Advantage. Now, the best time to enroll into a Medigap supplement is during your initial enrollment period, which, if you remember, is when you turn 65. But here's the key. This period lasts 6 months and begins the first day of the month in which you're 65 or older and enrolled in Medicare Part B. And this is the key. Enrollment into Medicare Part B, which means you cannot get a Medigap insurance unless you have Part A and unless you have Part B, because basically that is the most they cover. So if you have Part A but you don't have Part B, you cannot enroll into a Medigap. But when you get Part B for the first time, is when the 6 month period begins. And that is what we call the Medigap enrollment period for guaranteed issue, which means they cannot refuse you no matter what is the condition of your health. So, and it's also guaranteed issue as far if you, it's a guaranteed renewal, which means they cannot drop you like Medicare Advantage can. With Medigap, if you decide to re-enroll, they cannot refuse you. It's a guaranteed renewal. So that's the great thing about Medigap too. So that's why I like Medigap. Okay, so we have come to the end of the Medicare supplement. Again, there is a lot more to learn, but this is the basics. You have a good understanding of what each plan does against original Medicare. Later on, I may do a tutorial or just write an article about Medicare Advantage versus Medicare Supplement or Medigap. But their next tutorial is going to be on Part D, which is the prescription drug. So until then, have a great and wonderful day.